evening and good to have you with us on another edition of the Urban Debate. Continuing with our focus on the key medical infrastructure in our battle against COVID, the shortages, the lapses and the policy issues. Tonight, viewers, we break it down into 4 key metro cities. The issues are largely the same, a little bit different in each of the city depending on where they are in the COVID curve. But the experiences, the struggle of the common man is no different. Tonight, we're going to talk about Mumbai, Delhi, Bengaluru and Kolkata. And I will tell you as we go to each city why we've chosen them and what is going wrong or what needs dire attention. I want to start off with Mumbai first because there's been a lot of conversation in the last 24 to 48 hours about how cases are coming down. And it is true. If you look at Mumbai's daily number of cases, they do seem to be coming down from 1 week ago. As of April 20th, Mumbai registered 7,200 cases. Gradually, it came down to April 26th, with it registered 3,800 odd cases. But there is also another statistic that you need to look at as you look at this data, which is the testing numbers. So when we were registering over 7,000 cases, we were conducting over 45,000 tests. As of April 20, that's the number that we are looking at. That number has now come down to 28,000 as of April 26. So yes, while our numbers have halved, so has our testing. And we don't even know the breakup between rapid gen tests and RT-PCR tests. That's one thing we need to keep in mind. Of course, Mumbai has now been in a state of lockdown. There were strict conditions and then pretty much a lockdown that was announced. So there is a possibility that a fall in cases is also because we're all locked up in our homes. But that can't continue forever. So we have to figure out where our problems lie and fix those problems. Are we doing that? Or are we jumping the gun with the celebration on numbers coming down without understanding that big challenges still stare at our face? Let me tell you what the Bombay High Court had to say about the Maharashtra government and its dealing of affairs. The Bombay High Court said that the state is playing a hapless victim. A hapless victim. That the state is playing with the lives of people. It wants patients to die. That the state is the parent to all citizens, but you are letting your children die. The Bombay High Court then went on to say, futile exercise, this entire thing, no effort from the state, you're not giving us proper information, look for solutions, not problems, please, just don't pass the buck. Specifically on the issue of arranging drugs like Remdesivir and distributing them to where it is needed, the Bombay High Court had very, very strict things to say. So where do we go from here? Can the state get its act together while we are in the state of this lockdown? Or are we going to open up again and then go into another mode of crisis? Let me say good evening to those who are joining us right now. Dr. Sameer Dalwai, spokesperson for NCP and a developmental pediatrician, and Dr. Abhay Shukla, national co-convener for Jan Swasthya Abhiyan. Dr. Abhay Shukla, we looked at the numbers for Mumbai, but what about, other cities like Nagpur, Pune, Nasik? Are we beginning to see the effect of lockdown and can we already heave a sigh of relief?
So Tanvi, I think there is definitely a somewhat positive situation, although it is too early to say how significant that is. But in Pune, for example, from a peak of 1.25 lakh active cases, now we have come down to around 1 lakh, a little less than 1 lakh. In the last 1 week, this decline has taken place. And as you have mentioned, in Mumbai also there is some decline. But this, we should not get over enthused by this because the levels of transmission continue to be high. And, a lot of intra-household transmission may also be taking place. We may not be picking up all of that if the testing levels do not remain high. So I would say that, there is a initial small positive ray of hope, but there is no scope to let down the vigilance. And testing needs to continue at a higher level to pick up intra-household, transmission of cases, cases in rural areas which continue to take place in many districts of Maharashtra, including Pune, Nagpur, Aurangabad and so on, where the epidemic has spread to rural areas also. So, we cannot be complacent at all.
Yes, because the infection rate is still very fast. Now, Dr. Dalwai, should this be a time where we look at lower testing figures that just gives a false sense of complacency to people?
Yeah, good evening, Tanvi. So I don't think it's only the lower testing number or something like that, because if you see right from March 2020, Maharashtra and Mumbai have been at the forefront of maximum number of testing. What has happened is we are seeing the impact. Let me be very frank. I think the biggest advantage I would say that Mumbai has, as well as the reason for this improvement, is the people's cooperation. I think people have completely, very seriously supported the measures and all the advocacy that has been done, especially in the last 1 month. I think the media also played a big part in that. The government has been advertising about it, and people have responded with the COVID appropriate behavior. Yes, I agree, maybe it have been a little late, but first I'd like to thank and appreciate the role of the common man to have cooperated with this. Secondly, again, to be honest, Mumbai especially already has, I mean, probably one of the best infrastructures, medical health infrastructures anywhere in the country or Asia. So, at least this part of Asia, I must say. So, of course, we have an inherent advantage of the medical system here. The third part is the measures announced in terms of the lockdown. It was one of the first states to announce the lockdown, and at the same time, a slew of measures was taken by the government, announced by the Honorable Chief Minister, including simple things like support to rickshaw drivers, support to taxi drivers. The Shiv Thali was given, even delivered home as if possible. So all these things have prevented a large-scale alarm that we saw last time, and people have managed to support the lockdown. And I think we are seeing, as you know, it's not a yesterday's effect that will be shown today. It's a period of over the last 2 weeks that is now beginning to bear fruit. And I think with the cooperation of the people and the measures that are being taken, I'm sure we'll be able to get through it better. So this is what I would like to say.
No, that is fine, and you're right. It's absolutely about the people and what they have done and how we've clamped down and gone back in and locked ourselves up in our homes. But that obviously, Dr. Dalwai, is not going to be a long-term solution. When we look at the level of preparedness, there are still some things that are needed to be done. The Bombay High Court today said, how can the state be clueless about allocation? You're not even doing a district-wise allocation of Remdesivir drugs. How much time for allotment of drugs? What has the state done about it? That's as far as Remdesivir is concerned. I am still looking, and our reporters did this status check of the centrally run COVID dashboard for Pune, for Nasik and Nagpur. Now, hospitals are telling us a different story than what the COVID dashboard is saying. The COVID dashboard says beds are available. Hospitals say don't.
So Tanvi, from time to time, there might be a little discrepancy, because as you know, the situation is very fluid. And as you know, the turnover of patients also is very fast. Because currently I have examples of patients whose oxygen is not very good, and maybe a year back, they would have been given an ICU bed. But today, they cannot be, because there's somebody worse than that. But fortunately, even these patients are being managed better at home, because the overall medical advice that's being given and the level of preparedness of the patients and of the citizens to follow the medical advice is much far more better than last year. So a lot of people, as I am aware as a doctor, as a practicing doctor, are being managed rather well even at home, who would have been in the ICU by their parameters as compared to last year. Since we brought up the topic of Remdesivir, let me state on record that the Chief Health Minister of Maharashtra has written to the center, was one of the first persons or states to bring up the issue of a shortfall of Remdesivir on the 6th of April. Unfortunately, the entire quota still may not have arrived. There would be an idea that we would be distributing it adequately across the state, depending on where there is a maximum need for it. Please let us also understand that every patient who's diagnosed as COVID positive does not necessarily need Remdesivir. And this is, I think we've been able to use that very judiciously, at least in Mumbai, from the hospitals that I am connected with and I am aware of, that we are not using it unnecessarily. So there is definitely, I'm not denying the fact that there is a shortage, but it is not such a big issue as of now as was perceived to be. Patients are getting the medications, are getting Remdesivir, are getting the care, and we are trying our best to see that each and everyone gets care based on equity, as in what he or she
That's
requires.
not what Dr. Dalwai, the High Court, is saying. if we are not able to provide the basic plan that is in place on how we're going about it to the Bombay High Court, how are we actually doing it on ground for people? How do we confidently say situation is better, we've got a handle on it? We couldn't tell the High Court about what our system is, how the drugs are coming and going. Every now and then some Neta stands up and says, oh, I have 500 vials, I have 1000 vials. Now Netas are actually hoarding these vials and distributing it for their own brownie points. That can't be an organized system.
That unfortunately,
Can I say something here?
That would be a political point, so I don't want to get into that because I don't want to blame any political party or person for having done that. But let me assure you, see, there are two issues. The High Court would definitely have an overall point of view. And I admit, as a medical person, we should have a debate entirely on what were we doing all these years. And I'm not just saying for the last particular government or some other government. On the whole, we need to relook, but today is not the time to talk about it. What we have to do right now is we have a crisis on hand. What is the best way we can manage it with the resources at hand? And to that, if the Honorable High Court has passed a remark which is not very pleasing, I can understand that. At the moment, what we have to strive is each and every person in the city who needs the care, the equitable care that is necessary, is provided that. I think that is what should be our focus on the day.
I am looking at, statistics from across the place. Here is the latest figures that our research team has actually pulled out on availability of beds in the city of Mumbai. The city that is actually registering 4,000, 3,000 to 4,000 cases every day. At a lower level, we were at 7,000 a week ago. We have 48 ICU beds vacant. We have 23 ventilator beds and about 1,000 oxygen beds left. 48 ICU beds and 23 ventilator beds for a city like Mumbai. Meera Bhayandar Municipal Corporation, right at the outskirts of Mumbai, the suburban Mumbai as it's known as, has the Deputy Municipal Commissioner has said all our ICUs are full as of now. They only have 40, all of them are full. Vasai Virar, again, on the outskirts of Mumbai, suburban Mumbai, has 17 COVID hospitals, but the official who manages bed allocation says all our ICU and ventilator beds are full the last time we checked this noon. Oxygen shortage continues with ICU shortage. That is still the reality that we are tackling. Dr. Abhay Shukla, basis the pace of infection we are seeing even now in and around Mumbai, in cities like Pune, would you say that we are in for this lockdown-like situation for a little longer if we have to get a handle on it first?
Before that, I'd like to continue the point on Remdesivir. And I'd like to make a strong point here that a lot of irrational use of Remdesivir is going on, and that is not being adequately regulated. ICMR AIMS has come out with a very clear algorithm, and actually WHO and ICMR have taken a clear stand. Remdesivir has no role in reducing COVID mortality. I repeat, no role. This is the international, evidence. And even ICMR AIMS have said that it can only be given within the first 10 days of illness, and that also only in certain specific, moderately ill patients. And there it will just reduce the duration of illness for some period. It does not bring down mortality. However, Remdesivir is being prescribed left, right, and center by all kinds of private hospitals, and there doesn't seem to be any effective regulation of this, nor is there a strong public messaging campaign to say, don't demand Remdesivir as a kind of a panacea. It's only a specific drug for a limited purpose, that also only in certain patients. So why is there not, a strong public information campaign which will reduce the panic and reduce the artificial requirement of Remdesivir so that those patients who genuinely need it will be able to get it? I think the state government needs to have such a clear communication campaign.
So because you raised that issue, before we move on, Dr. Abhay Shukla, you made a very valid point. And repeatedly we heard this from all experts. Dr. Dalwai said it, you have said it, ICMR says it, government says it, that Remdesivir is not really the solution for all kinds of COVID patients. Yet the unabashed prescribing of this drug goes on. I mean, people are only running helter-skelter. And why are we talking about it? Because people are running helter-skelter. Every day, each one of us is getting 50 requests for need for Remdesivir from, across the country in various states. It's what is happening across the country. So maybe you are right, and there needs to be some tougher action warning being issued to those, Dr. Dalwai, who are prescribing this. patients are not asking for it themselves. They're only doing so because their doctor told them Remdesivir is required.
Tanvi, let me answer this as a medical practitioner, please. Dr. Shukla is absolutely right, but let's look at the practical situation on the ground. I am not saying this as representative of any government. The common man in Mumbai knows today that if I have COVID, the only thing that can save me is Remdesivir. I completely agree with Dr. Shukla that this is the latest research. ICMR has said that, but I'm sure all of us know that by the time ICMR says something and it gets translated to the ground level, it takes years in a normal course. Today we are in the grip of a panic situation. So it's the common man's perception today that he needs Remdesivir. I have had examples where doctors are telling me that patients are saying, "Isko Remdesivir क्यों नहीं दे रहे आप?" So this is the level I absolutely agree. There should be a public information campaign. But right now the mood is such that it may not be the right thing to tell people, hey, look, you don't need Remdesivir right now. That's what the government is saying. That may again be perceived in a different way. So I agree with you, but I'm only saying that it cannot be a shout out from the top, from the hoardings, saying that you don't need it. It may convert a wrong impression. But I agree with you, Dr. Shukla, that we should be better getting across this message, at least to the government, municipal and the bigger private hospitals, as well as the smaller private hospitals, to regulate the use of Remdesivir. We should be and we will be getting the guidelines out to them much faster. And I thank you for bringing this up on national media.
Okay, Dr. Shukla, to the other question that I asked you very quickly and answer, and obviously I'm not asking you to be, because you won't be the one taking the policy decision, but as an expert, do you believe that some of these restrictions will have to continue for us to break the chain?
Yeah, let me put it this way, that lockdowns are not the ideal way to deal with this illness. We know that more specific circumscribed restrictions rather than blanket restrictions, they do a better job. But, you know, in the absence of that, the government was probably forced to, its hand was forced to bring in this kind of semi-lockdown or partial lockdown situation. So I can see that it has had some effect. You know, this could have been done with perhaps less economic damage through more focused, you know, and aggressive contact tracing, testing, containment, and, you know, focalized isolation rather than blanket lockdown. But once it has been implemented, we are seeing some positive effects, I would say. So I would not rule that out. But what I am more concerned about is that the infection is still spreading in peri-urban and rural areas. So even if we see a decline in Mumbai, we are seeing a significant level of infection in Thane. The number of infections in Thane are, I think, comparable to, the number of active cases are comparable to Mumbai at this point of time. And it's also spreading to peri-urban and rural areas. In Pune, we are seeing the same situation. In Nagpur, we are seeing the same situation. So we are not out of the risk zone at all. The infection is continuing to spread. And therefore, active contact tracing, containment, isolation, and better home isolation and better communication about home isolation is very important. Maharashtra government should revive the local COVID care centers and isolation centers which had been put up in the first phase. They should be reactivated. There were COVID Dakshata Samitis in each and every village in the first phase. Those should be immediately reactivated. There are lots of volunteers can be brought in to support the government efforts.
Okay.
We should make much more efforts for that.
Okay, thank you so much for that. I'm out of time on this one, but this is as far as Maharashtra and Mumbai specifically is also concerned, and the other key cities cannot let our guard down, cannot begin to celebrate as the numbers come down. Yesterday the numbers were lower than 4,000. Today the Mumbai numbers are 4,000, but so is the testing. So if you see, the positivity rate is still 30 to 14%, which is not a good number at all, especially when we know that there is a double mutant that is spreading faster across the state, especially when we know that our healthcare infrastructure is just not ready. We just haven't done much over the last 5 months, and so we need to build that up very quickly. Few more days left to go for this lockdown that was announced. Will the government relook at it and look at extending it? Remains to be seen. We'll see what the Maharashtra government does. Let's move on and put the spotlight now on the national capital. The national capital again has its own set of curbs in its own kind of a pseudo lockdown state. Look at the numbers. If you see the daily cases, yes, there has been some amount of decline from 28,000 cases being reported as of April 20th. We're now looking at about 20,000 cases that were reported on April 26th. Again, a large part of the population has been locked up at their homes. A lot of places have been shut down. But I also want to highlight, just like the city of Mumbai, this is also a story. When you look at the falling cases, you need to look at the number of tests being conducted. So if on April 20th, 86,000 tests were conducted in the national capital. They have been clocking extremely high numbers on a national average. As of April 26, those numbers came down to 57,000. So in comparison to what Delhi has been doing when the cases were higher, the testing has also come down. Look at the positivity rate. The positivity rate was 30%. 30% as of April 25th. And 35% as of April 26th. The positivity rate gives you an idea. If you test 100 people, 36 of them end up turning positive. That's how widespread the infection is in the national capital even now. And they got a bashing today from the Delhi High Court. Each and every lapse, mismanagement was pointed out by the High Court, and the Delhi government was questioned. All the politicking, all the blaming the center and other people aside, there were some answers that the Aam Aadmi Party government did not have for the Delhi High Court today. The Delhi High Court said hospitals are still moving court. What is the point of creating infrastructure when they have to come to us? If people are not falling in line, take action, take over the plant. Oxygen cylinders are being sold in black for lakhs of rupees. There is a man who's got thousands of cylinders and oxygen available, and he's not even on your list. What are you doing? Was a serious question asked by the Delhi High Court today. You're only distributing lollipops when massive amount of oxygen is available there, being sold in lakhs. Get your own house in order, or we'll ask center to take over. This is what the High Court told the Delhi government today. A state's responsibility to compensate those who have died due to lack of oxygen or are dying due to a lack of oxygen. It is clear that the Delhi government has to pull up its socks. Now, I have many questions for the Aam Aadmi Party. The Aam Aadmi Party's representatives were not available to take our questions today. Let me say good evening to those who are joining us on this panel. Javed Ansari, senior journalist, joins us this evening, and Mr. Sundar Balakrishnan, a political analyst, also joins us this evening. I just wanted our viewers to know that the official representative wasn't available to take our questions on a day that they got some serious pulling up and bashing from the Delhi High Court with very justified points that were being raised. Mr. Javed Ansari, is it a case where there wasn't any interest in handling the situation? Is it a case where they got overwhelmed with all that they had to do? Is it a case that they got distracted by all the blame game and didn't really do their job? What is your view of the Delhi government's handling of the crisis today?
The Delhi government, like the central government and other state governments, took its eye off the ball, failed in its duty to augment resources when they had the time between November and March 21. They took their eye off the ball. Like everybody else, they convinced themselves that this pandemic had vanished, that we had got the better of, and they moved on to other areas. If they had augmented services, if they had arranged for oxygen, even the number of beds that the central government and Delhi government together had put in place in Delhi, they were withdrawn. The Radha Swami Satsang had put up about 10,000 beds. Because the numbers came down, that was dismantled. The Tatas and the DRDO came up with a huge hospital, makeshift hospital, with about over 1,000 beds near the T1 terminal, Delhi airport. Even that was denotified and withdrawn because everybody just dropped the ball. Everybody just convinced themselves that we had got the better of the pandemic. And then came this vaccination drive, which just never really took off. We were very lackadaisical from the top to the bottom. There was no adherence to COVID behavior. If you saw the markets in Delhi, if you saw people in Delhi, they were just moving around as if there was no such thing called corona, leave alone social distancing. The few people that were wearing masks, most of the others either had their masks on their chin or just covering their lips and not covering the nose. So what was the point? I mean, everybody just dropped the ball, and today the citizens, the residents of Delhi are paying with their lives.
Yes. And as much as I say that all of us let our guard down, and so some amount of blame is ours, it's the messaging that came from the governments, it's the messaging that came from the political leaders, it's the messaging that came from election commission that had thought it is okay to hold an election and campaign rallies and hundreds and thousands and lakhs of people gathering for melas and rallies that probably just made people even more brazen about not bothering to follow any norms. That being said, we are now staring at a situation, Mr. Sundar Balakrishnan, that needs government handling. And all the time, all that we hear from the AAP government is saying, well, we are trying, but the center won't give us this, the center won't give us that, the center will not do this, the center won't allow us to do that. Can we, for once, take responsibility for what we have to do and say, okay, we are not able to do it properly?
Tanvi, I think today you name the state, every state has faltered. Even Aam Aadmi Party, Delhi has faltered in this. Now, if you are going to tell me that let the state take over, I'll tell you even the center has faltered massive. I am telling you. In fact, if you know, recently there was a report, the top disaster management panel, which was supposed to meet between November, they did not even meet between November to March 21 for such a long gap. And if you notice, all these top politicians of the government officials, all these people were busy in the elections. Now, the center also does not have the proper infrastructure. Now, they have been importing ready to install oxygen plants from abroad. They don't have, we don't have. In fact, 20 cryogenic tankers are being imported. There is an oxygen shortage here. Now, today the supply is absolutely so minimal, demand is so huge that every hospital is crying for bed or oxygen. Now you cannot put a blame on center or a state or anybody else. Now the problem here is there has to be a proper coordination. Now when it comes to coordination, the nearby states are not giving any help. When you want any help from the BJP government, from the center, the non-BJP government in the states are being made the scapegoat. They are not given the right infrastructure. They are not given the right vaccines. Now you take the very recent case of this pricing itself.
No, Mr. Sundar Balakrishnan, you are doing the same thing. You're doing the same thing. What did the states do for the last 1 year? And just because in Uttar Pradesh and Maharashtra didn't do it right doesn't justify Delhi not doing it either. Then Delhi and the Delhi government should just keep quiet. They have absolutely no moral authority, no moral high ground to question the center for anything. If they haven't done their job, they did zero in terms of creating an oxygen supply mechanism. How are they importing it now? How are they arranging for it now? They are doing it now. Everybody has found the solutions now to do it. So please, let's not say that it was the central government who had to do everything and the states didn't have to do anything. They need to admit that they went off to sleep for the last 5 months, 6 months after the cases began to come down.
I'm not saying that.
And now they're blaming others.
I'm not saying that. I am telling you, let all the state government give up. Let central government take it. I am only saying the central government also has faltered on many accounts. That is what point I want to make, which you are not accepting the fact. Now, you tell me, how is central government also very so clean in all these matters? Have they been ahead of time in all these matters? No, they have not. So everybody has faulted. I am not supporting Aam Aadmi government or anybody. Today, it is not BJP or non-BJP. It is the question of all the state and center to come together and work towards it. That is what point I am making. Is the central government in a position to take all the state government functions and run the oxygen plants, supply the oxygen across all the states, give remdesivir to all the states, ration all the vaccination? Are they in a position to do it? They have not met themselves. They have not met as a national disaster management panel. They have not met. What planning can they do for the states? If they have not met at the center, what kind of a direction they can give the state? Is that not the right question that I'm asking?
No, but and we are questioning the center more than enough. We are questioning all state governments as well, and each state needs to be accountable for what's going on. The High Court, Mr. Javed Ansari, wrapped the Delhi government on Remdesivir as well, on oxygen shortage as well, saying get all information on Remdesivir stock. The government doesn't have information to give to the court on what is the status. You're unable to deal with the numbers. Is there a systemic problem as well? The governments have just don't know what to do, and it's now just been left to people, Mr. Javed Ansari, to figure it out for themselves. Where will you get your oxygen? Where will you get your bed? Where will you get your remdesivir drug? Go around asking, begging, borrowing from others, and handle it yourselves. Is that the situation now in the national capital?
You're spot on. The failure lies at the door of the central government and the state governments. Everybody dropped the ball. Everybody became complacent. The center certainly did not take the kind of steps that it was supposed to take. This empowered committee of central government officers, they presented a report. Very little, precious little was done about it. And if something was done about it, then the people of Delhi don't know. And if some action was taken, and yet we are facing the kind of situation then even the gods can't save us then. So the fact of the matter is that Mr. Kejriwal's government has gooped up, and so has Mr. Narendra Modi's government, and so have state governments.
Yeah.
Everybody was just caught unawares. We just convinced ourselves. I don't know for what reason and what on earth went on in our minds, but everybody just seemed to have convinced ourselves that this problem is over, that this pandemic is over. Our health minister went on air to claim publicly that this is the end game of corona, and now corona has exploded in our face. People are dying by the hundreds. People are dying in corridors, dying on pavements. There are no beds, there are no oxygen cylinders, there are no life-saving injections, and there's a paucity for everything. And people in Delhi and the rest of the country, most parts of the country are surviving on a wing and a prayer. It's up to the gods. Those of us who outlive this will never forget this situation in our lives. And I do not believe that anybody in this country has done anything to deserve this.
Yeah, correct. Well said.
No,
well said,
absolutely not. And you said this. Governments were caught unawares. I would say the governments were caught abdicating their responsibilities and sleeping, napping, looking at other things, fighting for power, and not doing their job. All the promises that they themselves made last summer, Mr. Javed Ansari, they have not delivered on any of those promises. Any of the promises. And that goes for most state governments, barring a few who may have done a little better, but they were also already on a stronger foot as far as healthcare infrastructure is concerned. I'm going to thank both Sundar Balakrishnan and Mr. Javed Ansari. I really wish, though, we had an Aam Aadmi Party representative on the channel to take our questions. There were some very serious lapses highlighted by the Delhi High Court. Very, very serious questions posed. And I want to tell you this as well. The entire controversy that emerged after the news came out that a 5-star hotel in the national capital has been put aside and created and will be converted into a COVID facility for the Delhi High Court judges, and it became a huge story. Well, the Delhi High Court itself today then asked the Delhi government, what are you saying? Where is this order coming from? We never asked for it. They were even pulled up on that. They were pulled up for issuing a wrong order. And where the Delhi government tried to put the blame on media and say maybe the media is projecting it wrong, the bench turned around and said, no, your order is wrong, withdraw it. This is the state of affairs and how it is crumbling in the national capital. Can only unfortunately and sadly say, like many other cities in our country right now, the struggle is your own with very little help from the governments. From Mumbai to Delhi, we now move on and put the spotlight on Kolkata, a city that is still in the middle of elections, a city that's seen voting take place yesterday and will see the final round on 29th. A state that has been in the mode of elections for the last couple of months with absolutely no concern as far as COVID is concerned. Repeated warnings from experts inside Bengal and outside Bengal have gone unheard. And this is a problem everywhere for all of those who say, oh, we never saw this wave coming. The wave did send you signs, did send you warnings. Experts were ringing the alarm bells. Only our governments didn't want to hear this. Take a look at what is happening now in Kolkata itself. The daily cases have gone from 167 cases that they tested positive on March 25th to 3,868 cases on April 26th. And believe you me, this is just the tip of the iceberg. And it's just the focus on Calcutta. Imagine what's gone on in other parts. The positivity rate has hit 32% in Kolkata. 32 people, every 100 people tested are COVID infected. Is the city really ready to handle this? Or are we looking at another repeat of what Mumbai was and what Delhi is right now? I say good evening to the panelists who are joining us on this conversation. Dr. Kunal Sarkar, cardiac surgeon with Medica Super Specialty Hospital, joins us this evening. Shuparna Moitra, spokesperson for the TMC. Dr. Kunal, if I can come to you first. Many like you had warned about this situation that is now beginning to emerge. Just how bad can it get for Kolkata?
Tanvi, would be an understatement of the century to say that the healthcare is stressed. I think the healthcare by this time is well and truly overwhelmed. And, it is a matter of frustration, desperation, what have you, that we are totally caught, absolutely paralyzed in not being able to help the people who are just desperately seeking for a hospital bed. And to my great surprise, you trust these pandemic statistics at your own peril. You have to be really gullible to be trusting the death figures and the positivity figures. Just one statistic matters right now. And that statistic is, I have a desperately sick patient with me. Do I have a bed? Do I have a supply of oxygen to treat the patient? Beyond which everything is irrelevant, everything is profane. That statistics is a flight of fancy at this point of time. And as you quite rightly said, there are two things. One is, we are still plagued by the constitutional curse, otherwise called the election. The political parties are totally drunk on the pursuit of power. And this evening, we've had an unbelievable diktat issued to us saying that the state government will not be responsible for the supply of vaccines to private hospitals on the 1st of May. Just look at this. The private hospitals will have to go and purchase the vaccine and return the empty vials. How ridiculous can it get? As it is, the government holds on paper 6,000 critical care beds which can at least supply oxygen. And how many have we deployed so far? 1,800. On paper, West Bengal has 130,000 beds somewhere, I believe some of it exists. How many have we used for COVID so far? 10,000. And people are really going from pillar to post. They are desperate just for a hospital bed which is capable to give the oxygen support. Never in our experience have we faced up to a sort of, a treatment tragedy like this. The government capacity does not match up with the facilities provided.
And Dr. Sarkar, my concern is that this is not going to change in terms of government support anytime soon until the results come out, another few days till things settle down. What do you need right now on emergency basis from the government? We are now seeing across the country various state governments wake up and figure out how to get oxygen, where to import the tankers from, where to get the concentrators from. What about the testing policies? What about our admission triaging systems and central dashboards? What would be the need of the hour for Kolkata to handle what's coming its way?
Well, the step number one is to stop all this monkey business that is going on with the elections. We still have one phase of that curse left. The more we can minimize the damage, the better it is. Secondly, with folded hands and being on our hands and knees, we pray to the government that please mobilize the resources that we have. There are still great big hospitals, government hospitals in the city, which have not even come forward and participated in this pandemic management. So we have to deploy our capacity today, right now. What are we saving ourselves for? And the third question is that forgetting all the animosity we've had so far between center and state, for God's sake, sit together, carve out a simple, implementable vaccination policy, because that is the only one tool that you and I have today to come out of this engulfing flame. If we fail to do so, if this tutu may with vaccination, center doesn't want to know, the state doesn't want to know, ultimately it's down to what? To a private hospital to procure the vaccine and give it to the people. When vaccine procurement is an international, country-wide phenomenon that happens through the COVAX alliance, do people know what they're writing about when they frame the circulars? Because if this is what it is, then come 1st of May, I fear that almost for the first week or 10 days, vaccination will be paralyzed.
Oh, yes, absolutely. That will actually probably not just be the story of Bengal or Kolkata, but in many other parts of our country where vaccination is going to be, I feel, coming to a grinding halt outside of what little center is providing to the states right now, because none of the states have any plan or any clarity on when they're getting the stocks. But Suparno Moitra, we've spoken about this earlier. The numbers have begun to show the reality, Mr. Moitra. You could have said a month ago that there is no COVID fears right now in Bengal and we are handling it properly. But look at what's going on right now. Is the state on top of it? Doesn't look like it.
Ms. Shukla, good evening. Good evening to Dr. Sarkar. Please allow me uninterrupted time to mention a couple of points. Number one, before we get into this discussion, I think the highest court of the land and also the courts of respective states, the honorable courts of respective states, are aware that after 73 years of independence also, the spending on public health care is only 1.26% of GDP, and the per capita spending is at nominal rates is only 1657 rupees by 2018-19. Second, so public health care has been ignored largely in India, and there seems to be a renewed emphasis on that. One. Two, when looking at the data, I would quote the data by the study done by the Center for Disease Dynamics, Economics and Policy based on the National Sample Survey 75th round and the National Health Provide 2019. They have clearly shown a couple of things. What points which have really been articulated by them are that the estimated approximately 19 lakh hospital beds across the country, 95,000 ICU beds and 48,000 ventilators in the country. Most of the beds and the ventilators are in 7 states, that's UP, Karnataka, Maharashtra, Tamil Nadu, Bengal, Telangana, and Kerala. Next, the existing bed capacity is almost saturated, and the accommodation plan of COVID-19 patients will require rapid expansion of capacity or modification of policy for routine patient care. Now, West Bengal, if you compare with many other states, be it on the hospital beds, be it on the number of hospitals, be it on the ICU, and be it on the is on the top 5, top 6 position across the country. Now, having said that, let me tell you as far as the Bengal position on COVID is concerned.
Talking about
Now,
Mr. Moitra, because that's really not correct. Take a look at the situation of your Kolkata hospitals. You will know what the reality is. I don't need to tell you, so you shouldn't even be pretending as if you don't know. I don't even know what your testing numbers are because your state doesn't give it give out very clearly how much of testing you are doing. I don't know what the positivity rate is, what the testing data is from Kolkata. You don't even give us the data, let alone talk about the reality.
Ms. Shukla, I request you to... Ms. Shukla, please allow... We'll check it in the public.
Yes, go ahead, please. Answer my question.
One. Second thing, with regard to this is a very, very specific situation, and there needs to be the center and the states who are working together. And let me tell you, as far as we are concerned, we have organized 200 safe houses. We are providing 40,000 vaccine doses per day. We have taken over 80 private hospitals with 7,326 oxygen beds along with PCU and HDU. Number one. And with regard to the oxygen that you are talking about the state, this is a bunkum by the Bharatiya Janata Party. Now, with regard to the oxygen thing also, let me tell you. Now, the Center for Medical Supply Stores, CMSS, is an autonomous institution of the Department of Health and Family Welfare. They were allocated 201 crores by the central government to set up plants. The state governments are not in charge of that. And in fact, the money also lies with them. They issued the notice inviting tender on the October 2020, and the press notification came up by the center. So the state has nothing got to do with it.
Again, you're doing the same thing, Mr. Moitra. I'm sorry I have to interrupt you because I am out of time, but let me just add to what you said. What the center did announce and never did cannot be your excuse for your failures. What the states didn't do is what you need to look at. This healthcare infrastructure is a state subject as well. Now, if you're going to raise our hands and say everything is the central government's responsibility, then so be it and God help us. Because none of the states want to do anything. While we continue to question the center on what the larger scheme of things was, for 1 year, states could have also worked on streamlining their processes, streamlining their drugs availability, streamlining their oxygen availability, where they're going to get it from, how they're going to do, how can they generate oxygen at their own level, can they push the hospitals to really start doing that, what about testing, what if this number doubles today, what happens when the second wave comes? A second wave that has hit almost every other country in the world, and we thought it won't hit us, it seems. Time for a quick break. On the other side, we put the spotlight on Bengaluru. Thank you to Suparna Moitra and Dr. Sarkar. Always good to have him. Quick break. We'll be right back. For spotlight on the fourth city, the city of Bengaluru, where also the COVID trend actually has been on the rise, contrary to the number of cases coming down in Mumbai and Delhi. Even though the situation is dire, Bengaluru is actually the one that has seen cases go up from 13,700 as of April 20th to 16,545 cases yesterday. In fact, it's now on similar levels and beginning to cross what Mumbai and Pune have been witnessing, which have been the worst of cities for the longest time in this pandemic second wave. And what is it leading to? It is leading to a complete collapse of the healthcare infrastructure and a denial from the governments on what the reality is. So if you look at the picture right now for government hospitals, there is only one available bed. The last time we checked it, an available ICU bed in government hospital, and almost all of the ICU ventilator beds were also occupied. The situation when it comes to private hospitals is such that they are constantly taking the government head on, refusing to follow the orders, notices are being issued to them, and that's where the situation with private hospital lies. And it is getting worse The city and the state has gone into a kind of a lockdown now as the cases rise. What does Bengaluru need to do next? That's the big question. The Karnataka High Court raised an alarm over the soaring caseload across the state, and while the state grapples, the High Court highlighted glaring lapses in the system. The same old story in every big city that's seeing a complete collapse of governance. And I say good evening to two panelists joining us from Bengaluru, Dhanya Rajendran, editor with the News Minute, and Mr. S. Prakash, spokesperson for BJP Karnataka. Dhanya, not only are the states failing, they are also actively denying the reality to us. Again, in Karnataka, as your own investigation shows, there is a massive mismatch on what the government tells us as death figures and what we are actually seeing.
Well, yes, in fact, the story we did today showed the discrepancy numbers in what are the deaths reported in the state bulletin and what are the actual number of bodies being cremated. There is definitely a huge difference, and I hope the government does bridge that gap. I mean, I don't know what is the compulsion for governments to really show that the death data is less. If you're not going to tell the truth to the people of your state, then they are going to be callous. They're going to think that everything is all right and carry on with life as usual. But one thing I would like to add here, Tanvi, is that the Karnataka government at least has been forthcoming when it comes to oxygen, when it comes to other facilities. For example, the chief minister has been continuously writing, the health minister has been saying that they will be in short for oxygen. That's something that they did not try to hide at all. In fact, Karnataka was one of the first states that started telling the center that we need more oxygen supply as soon as the problem started in Delhi, which is the reason why the center has given them 800 metric tons of liquid oxygen. Now, it's not reached Karnataka, but the center has promised. But the big problem really, Tanvi, is that this second wave was expected. And Karnataka has increased the number of oxygen beds and ICU beds, but still not as much as a large state like Karnataka should have. And it's also not really spread out across all districts. So there was much more the government could have done and should have done.
Where did it all go wrong, Mr. Prakash? Why did we become so complacent thinking that the second wave is not going to hit us? Or was your own understanding of it wrong? Or did you not see the signs coming when Maharashtra was seeing a massive spike, when Kerala, two of your own neighbors, were actually facing a massive problem right in February? Why didn't we prepare better?
No, blame game is the very easiest thing to do it. We are facing a very serious pandemic situation. In a matter of 20 days, the numbers spiked from 500 to 800 to 20,000, 30,000. And that kind of a number was increased in Karnataka. And certainly the health infrastructure will be under tremendous pressure. And the state is definitely is managing. I agree with you. There are shortage of beds, shortage of ICUs. I'm not denying that. But government is going all out to ensure that every patient who deserves a bed and a ventilator is provided. State is prepared, but maybe the numbers have gone sky high. There are some shortcomings which needs to be plugged, and the government is on the job.
But now, to say that now you're on the job is actually to say that you are extremely late. That's exactly the point, Mr. Prakash. Why did we not prepare this and plan this in advance? Okay, you saw that the oxygen would be a problem, but when is the problem? When is the oxygen going to reach? I have spoken to hospitals every day who have come, hospital doctors and management who have come on our channel, and every day they tell us that right now they're on their own in terms of figuring out where their next round of oxygen is going to come, and it's a bigger problem for smaller hospitals than the big ones.
Government is addressing the central government has already allotted 800 million metric tons, and it will shortly reach. And at no point of time the patients will be let down on that. The already Remdesivir 1.15 lakh vials have been sanctioned by our Sadananda Gowdaji, who is also heads the ministry, and other facilities are being ramped up. Nobody had expected overnight the figures would go this high. Certainly, to an extent, the state was prepared. When the numbers have crossed the estimate, there will be some shortcomings. that needs to be addressed. That's the government job, and they are at it. It requires everyone's cooperation. People, political parties, and every officer has to do his duty. I'm sure the officials and the doctors are working day and night.
See,
to
Mr.
address
Prakash,
the
we are
issue
not doing a
and
blame game
ensure
here. We
the
are actually
patient
questioning
receives-
the authorities who were supposed to do their job. As you see, there is no opposition party here. There is no blame game. I am seeking accountability when your database is not updating on time, when you don't have enough ICU beds or ventilator beds, when people don't know where to go, when there is massive delay in testing. How will we contain the problem?
No, I'm not saying you are doing blame game at all. I'm saying I'm explaining the situation in Karnataka, how it is being addressed. That's all.
Then we've seen repeatedly across the country, state after state, the high courts have stepped in and asked very serious questions and posed very serious questions to the state governments. One of the largest problems has been preparation when it comes to critical health care, starting from testing. Now, is there a sense that while test reports are getting delayed because the labs are overburdened, they're also being penalized for not following protocol in Bengaluru?
I think Bengaluru and Karnataka, like almost all others,
considerably.
Now, the issue really, Tanvi, is that as Mr. Prakash said, yes, the numbers are really going up. Any health infrastructure will come under pressure. There is absolutely no doubt about that, and everyone has a duty in the system. But the question is, the Technical Advisory Committee in Karnataka says they had said that the second wave will come, that there will be a massive increase in cases. Then why was forward planning not done? That's a simple question. Now, of course, we have to move ahead. I mean, the time for questioning perhaps over. What can Karnataka do now? If every day we are going to witness 30, 40,000 cases, today we have reached 30,000 cases in Karnataka and 17,000 in Bengaluru alone. So if this continues for another week, then what happens? Because what we are seeing in the second wave is that what doctors tell us is that patients are being hospitalized for a longer time. It is taking more time for discharge, which means the beds are reserved for longer time and more people in the queue. So what should Karnataka do now? They have to immediately increase beds. They have to make sure that all these promises that the central government has given them, including giving vaccines, including giving oxygen and other medicines, has to be fulfilled immediately. And Karnataka also has to make sure that it appoints medical personnel. We have a dire shortage of nurses, of doctors, of all kinds of medical professionals. That has to be done. And I'm asking, why were no lessons properly learned from the first wave? Why is still there no triaging system in Karnataka? For example, we have one dashboard given by the BBMP and the Karnataka government, which still does not have properly the live numbers of hospital beds. It still does not show what are the number of beds that private hospitals have. And we do not know if there is a control room in Karnataka which does triaging. Basically, it puts patients according to priority. So these are things which should have been learned from the first wave. And I hope that the government will really do something in the next 2 or 3 days to come.
Yes, and you're right. When the situation reaches a certain level, the system, no matter how prepared you are, is bound to get overwhelmed. And I hope that for Karnataka, they have reached there and things won't get worse. But if there are any lessons to be learned from cities like Mumbai, Pune, Delhi, Lucknow, Ahmedabad, Surat, is that for Bengaluru, the cases could go up further. It's a good thing perhaps that there is at least a small short-term lockdown that has been announced and it sends people back. It should only be used by the governments to build up their healthcare infrastructure. The points that Dhanya just raised about lessons that we should have learned from our first time around and implemented them by now. Real-time tracking on the availability of beds, the app that should actually match with what the hospitals have on ground. And in a city like Bengaluru, so famous for its information technology companies, cannot get that right. It's just really disappointing. Availability of more testing labs, more testing kits, more manpower. How do you ensure that there is smooth processing there? Introducing the triaging system, which really makes the process simpler and smoother in terms of admission of people and patients into the hospitals, reducing their own struggle and pain, something that's been done in other cities and should be looked at. But again, a classic example where netas are probably busy campaigning in different parts or attending religious functions and weddings, assuming everything's fine, and are only waking up now. Big thank you to Dhanya Rajendran. It's always good to have her with us. Thank you, Mr. Prakash, for speaking to us and taking our questions. We will continue to put the focus on the big cities and the big problems. The problems of Mumbai today became the problems of Delhi tomorrow, and then for Bengaluru, and then for Kolkata and many other cities. And this could be the story everywhere. There is still time for many city authorities, corporations and administrations to wake up and get ready.